back, ladies and gentlemen, to Rejuvenate Edition 5. We are at day 1 and this is our second session. We just had a fantastic session with Zulaika as well as her parents. Zulaika was based in Texas, US, and then the parents were here in Malaysia, and we managed to get all three of them together and speak with us and literally to open Rejuvenate Edition 5 for us. So that was fantastic. And we quickly move on to our next segment, which is with Dr. Malini Karupiah. Welcome, Doctor. How are you?
Yeah, hi Andrew. Hi, I'm good. I'm just recovering from a bit of a flu, so I might be speaking a bit nasally. But I would like to say thank you for the opportunity, Andrew. Today.
Great, fantastic, and I see you are well dressed for the occasion as well. That's the Team Malaysia polo tee, if I'm not mistaken, correct?
Yes, exactly. Because I was involved with the Asian Games in Palembang, Jakarta in 2018. Yeah.
Fantastic.
So, yeah.
I like it that you are all geared up for the session. Now, for many of us who don't know Dr. Malini, she is a sports physician currently attached at Hospital Sedang. I will actually get her to explain a little bit more of her background, of what she does and whatnot. And it's exciting because today we're going to be talking about breaking gender perception in sports. And what do we mean by breaking that gender perception here? That's something we'll be also discussing in the session. So, Dr. Malini, again, once again, welcome to the show. Thank you for taking your busy time off to be with us here today. Truly privileged and honored to have you. So I suppose sports physician, what else can you tell us a little bit more about in terms of what you do and what is this whole sports physician thing all about? Please take it away.
Okay, thanks Andrew. So sports physician, in Malaysia, there's only one university currently who gives this particular master's program. So once you finish your medical degree, you work for a certain number of years, your housemanship, your medical officer, and then you apply for your special interest of masters. So for example, if you have a certain interest which you want to pursue further, and in Malaysia it's about 4 years in standard for any masters. So in Malaysia, there's only one university, they're providing sports medicine, University Malaya. So I did apply for that after working a number of years as a medical officer. And so once I finished my 4 years of masters, and I get to be known as a sports physician. And basically, we deal with a healthy population. A lot of them would like to know what's the difference between sports physician and even rehabilitation. So we deal more with healthy population. And if you're based in the Kementerian Belia Sukan, KBS, in the Ministry of Youth and Sports, you deal more with elite athletes. And if you're based in KKM, you also deal with the large population, which is also known as athlete, but we will call them as the weekend warriors. All of us are aware about. A lot of people as well, it's a different form of athletes. So we see a lot of a kind of population from the elite, from the weekend warrior, and also to geriatric population, the older population, as well as the adolescents and younger ones. So I deal a lot with a different kind of population at the moment.
Wow, that's very, I like the way you describe it because it's pretty clear in terms of the differentiation and in terms of roles and whatnot. Now, I suppose I want to turn back the clock a little bit and just kind of find out what got you into this. I suppose even back then it may not be a very common thing for women to be studying, sports medicine, for example. What got you interested into, or rather what got you into this pathway?
Okay, when I was younger, I was quite active in sports. I live in a small town in Port Dickson. That's where me and my siblings, I've got 4 of us in my family. I'm the third. So we were very much involved in a lot of activities, a lot of sports, especially competitive swimming, athletics, even squash, even tennis. So every weekend or even along the weekdays, if any competition were to come up, we used to go to the Royal Podixon Yacht Club. That's where we train for our competitive swimming. We also train for our tennis, our squash, and even in school we're pretty much active because we're always surrounded by, the same kind of mindset as they would say. So we have friends, we have relatives, and everybody is very much involved in this. So that's where I guess the interest developed. And along the way, obviously, once it comes to Form 5, we have a major exam, and I was going off to med school and pursue this. I think it was one of the university being offering to it. So we have an entrance exam where you have to pursue it, and you have to pass. So they will take like 6 candidates, throughout the whole Malaysia. Okay. So I was pretty lucky that I was one of them, because you have an entrance exam where you have to be able to score. And there's about 90 or 100 people, because everybody's interested in this program. So I'm just very humble. And also I did really, perform well, I would say, in my entrance exam. So I was one of the 6 of candidates in my batch to able to get into that program.
Fantastic, so, yeah. Fantastic. So from that, I can tell, I suppose, even from a young age, you've been very involved in sports, and it also helped that you had siblings who are also very involved in sports as well.
Yeah, very true, Andrew. So all of us were very much involved in sports. We were pretty much active. I think it all comes down to my parents. So like you said earlier, my parents have always told us to always pursue our interests, and they've always given us a lot of platforms to sort of like try a different kind of platform, from arts to music to swimming. Even let's say for music, I've got till grade 7 my piano, which I was just one grade shy of getting my diploma in my piano Yamaha exam, because I had to further my studies in medical school. And also, of course, sports came into the picture. So all of us, all my 4 siblings, actually, all of us are doctors. And, I think, as they say, you have to have the balance. In order to excel in your studies, you have to have also, your time of having sports. And my parents have always told us that, the more active you are, it's also help you in developing and to be able to focus in your studies as well. So if you ask me, I would say I would really, thank my parents for sort of like teaching us in a very young age. As you all know, grassroots level, even from a young age, like how important to have a balance of both, of being active as well as your studies. So yeah.
Totally agree with you, Dr. Malini. Now, move us straight into how you got into starting off your career. So obviously you finished your studies, and what was the first thing you did, and how did it evolve into where you are today?
Okay, so when we finish our masters, and then we do get allocated to certain hospital. So I got allocated to Hospital Serdang. So when I was based there, I had the opportunity to go and to be involved in the football matches, all right? Football Association Malaysia, FAM in short. So they used to call. So there's a lot of doctors, there's a lot of people are involved. So whenever there are matches, there's even tournaments or even team doctors and everything, they do call. So I was involved basically in a tournament and a match of the football from FAM, even including to the AFC. So where you get to go overseas, and you also get to be involved in other sports. So because of that, when you sort of like, they always say you are who you are surrounded by including your mentors, your colleagues, your bosses, and to have that kind of positive surrounding, and to be able to have that kind of networking. And I was just very lucky and blessed that, I was able to get involved, and the passion just grew even more, not just football, but even in hockey, and also any kind of activities and sports that are being assisted with even the National Sports Council. And I was just very blessed to have very good people surrounded by, like I said, mentioned earlier, like my bosses and my colleagues and just fellow sportsmen and even the sports community. And because of that, you get to pursue what you like. And I would say that's how I started my career.
Now, you are, as I know it, you are also involved in a couple of committees with the IOC, the International Olympic Committee and Council and whatnot. Can you explain to us a little bit about your work there as well?
Yeah, so I was very blessed and fortunate the fact that I've done quite a bit in my career as a sports physician. And that got me into the Olympic Council Malaysia, the Anti-Doping Medical Committee last year, which is headed by Dato' Shima. So I've been involved in that. So I'm extremely blessed, I would say. And even this year, the new term I've renewed, I would say, my contract in the Olympic Council Malaysia. So everything has been online now, the meetings. Yeah. And now with the pandemic, slightly it's a bit better. So we're hoping to have our first face-to-face and physical meeting, which is coming up very soon. Basically, I'm involved in that and also in a MASM, which is a Malaysian Association Sports Medicine Council. So I'm one of the executive members. And we use that as a platform to sort of like get the information out there, because there's so many people are very much interested to pursue this career. And me being one of the seniors, I would say currently, and it's nice to sort of like also to encourage the younger generation who wants to pursue this. And sometimes they just want to know how to go about and what are the right direction to get into it. So it's always it's a give and take in the community. As much as we get a lot of opportunity, it's good to give back, and it's also good to educate the younger generation on how to go about this career.
Now, picking up on your last point that you just mentioned, right? Over the years that you have been involved, how have you seen the shift in terms of getting more females to be in this career pathway versus when you first started very early on, I suppose? Have you seen a great shift in that? There are more younger girls who are coming in and say, yeah, I want to be like Dr. Malini as well and do the stuff that Dr. Malini does as well. Has that been, have you seen that?
Yeah, there's a lot. Even, a few of my juniors who managed to get into the master's program, the girls. Everybody is, because of the passion towards sports. And honestly speaking, it's a blessing, the fact that when you do go into this thing and somehow they sort of like don't really look into your gender, they just treat you as an individual, and that is something which I think every one of us are very blessed in that fact. And a lot of juniors are coming out now, a lot of girls, like you said earlier, and it's about passion, whether, whichever interest of sports or whichever games or whichever kind of career. I think it's sort of like just you as an individual. And if you have that passion, regardless about your gender, I think, anyone can succeed, you see.
That's fantastic. Now, I just want to draw back a little bit on a word that you mentioned earlier. You mentioned pandemic. Obviously, you are attached with Hospital Sedang, and I understand from our conversation, prior to the show as well, you were involved, as a frontliner. As you can also see from the promotional posters that we have pushed out, we had you in a PPE suit as well and stuff like that. Can you share with us a little bit of that experience you had during this whole, year and a half and the lockdowns and being in the hospital and whatnot?
Yeah, so as you know, Klang Valley, Selangor became, one of the main places where the COVID-19, the pandemic was really on the rise. And the government issued most of the hospitals in Selangor to be fully COVID. From hybrid, we became a fully COVID hospital, and Sedang was one of it. And everybody from whether you're in a medical department or whether you're in an orthopedic department, like me, I'm based in the orthopedic department, but all of us had to, go down and help out everybody. And it was as much as it was tiring, it was long hours. We had to work like 6 days a week. We had on calls. We have to work long periods, okay, and very high stress because everybody is trying to make sure, bring down the cases and everything. But in a way, it sort of united everybody, because everybody from consultants to specialists to medical officers, even to the junior MOs who are now under contract, we all came in as a team. And honestly speaking, I think the contract, without the contract doctors being the juniors, I think they were like more of the frontliners of the COVID, and we being involved in that, we saw them, and I hope that all of them will eventually get their permanent, as what they are sort of like working towards that now. And it was a very stressful. I would I wouldn't deny that, but everybody came in as one big huge family. It doesn't matter what is your position. It doesn't matter if you're a certain consultant or whether you're a junior most doctor, but we all came in as one family, as in one motive. Basically, is just to make sure everybody is, taken care of, given the treatment. We had doctors from different hospitals, even from the infectious disease, the ID specialists. Everybody came in to help us out, because we just want to make sure this pandemic can be curbed. So, it was a whole eye opener for us as well as a frontliner, and I have even more respect for everybody, and I feel that so many of them deserve even recognition. The fact that they were all involved. So I'm very blessed and fortunate that I was given this opportunity to be in the COVID-19 pandemic, one of the frontliners, because it completely opens up your eye. And now we are even more careful, even just not to my family and kids, but even to people around, So how we are going to live in this new, endemic, I would say.
Mm-hmm. You hit the nail right on the spot on every point that you mentioned. We are also, I myself included, truly appreciative and a lot of respect. My hats off to all the frontliners as well, people like you, people who have been working tirelessly over the last 2 years in helping us to curb this virus and pandemic. So really a lot of respect for all of you. I want to move on to the next segment, but I see that there's a question here which kind of ties back to this segment, so I would want to address that. Now, Ali here asks, hi doctor, medicine in sports is not very much a recognized career in Malaysia. How do you propose we can introduce medicine in sports to younger generation as their future career? So that's the question. I would also like to add on and perhaps ask you as well, sports medicine, how can we include that into the education curriculum a little bit more in schools today, I suppose? Back in my time, when you talk about the PJK class, right, the sports class, all we do is we immediately run out of classroom, we go to the football field and we play football. That's about it, But how can we change that today and kind of include a little bit more educational kind of make people understand what sports medicine is about? And there's a lot of career pathway technically. You don't have to literally be sitting in the hospital, for example. So I suppose that's the question.
Yeah, so basically he's asking a very fantastic question because it's a very new field in Malaysia, okay, compared to the UK and compared to Australia, because they're very much established. So this has been maybe about the past maybe 15 years, so something very new. But it's coming very much in the highlight now, because sports is becoming even more a bigger platform. People are spreading awareness. Clubs, association, they are giving more education, more talks about sports pathway and sports career and sports medicine especially. So if anyone were to ask me, how do you go about it? Like Edith mentioned, if you were to become a doctor, from there you have to work a certain amount of years, which is about 3 to 4 years, and then you're eligible to apply for the masters in Malaysia. Okay, they have other pathways where you can apply for diploma, in the Bath University in UK and everything. But the fact that Malaysia has a program right now and which they're trying to even go into even the other universities, because the response has been overwhelming by a lot of doctors who want to get into this pathway. So, and like I mentioned earlier, it's all about grassroots. It's about spreading awareness. And I think with being in the Malaysian Association of Sport Medicine and having the current president there, which is Prof. Halim, he's doing a fantastic job in getting all of us into having a lot of talks, a lot of platforms, a lot of workshops. So it sort of like builds an interest and sort of give an idea, an eye-opener about what is sports medicine is about. Even the Olympic Council of Malaysia, they're having a lot of workshops. They're having a lot of talks. So just not doctors, even a sports science, even coaches, even physiotherapists. So from anybody from the grassroots level, even from the schools, right up to universities, even to clubs and association. So a lot of things are being sort of like being highlighted right now, because like you mentioned just now, it is one of the sought after careers, I would say. And that is why we are more than happy to welcome, because everybody should do, like I said, once you do what your passion is, it doesn't become a job. It becomes something that you enjoy, you know?
Yeah, totally agree. Now, I want to move on to the next segment, but again, I saw a question popping up, and that kind of correlates with this one now. So I will address that first. This is from Jonathan Samuel. What do you hope to see more in the field of medicine in sports Malaysia, in present and in the future, I suppose?
Okay, so currently a majority of the sports medicine physicians, they are based in the government setting in Ministry of Health. And we have also our colleagues who are based in the Ministry of Youth and Sports, which they are based in the National Sports Institute, okay, ISN, Institut Negara. Yeah, ISN. So what I would like to see is basically, at the moment, everybody is working together. So whenever we have any talks, we have any meetings, everybody comes together as a family, you know, because sports is about unity. If you don't have any unity, there's no networking, it's very hard to sort of like get the information out there. And which is they've been doing all this while, and they are still currently doing, and we're going to see that more in the future. And my interest would be more getting into not just the Ministry of Health, but even the health sectors in the private, okay? Because we have surgeons are coming and working together with us. We have the physicians, we have the physiotherapists. So it's like a huge umbrella. And under this huge umbrella, there's a few departments that are coming into place. And everybody is sort of like seeing the importance of the need of a sport physician, you know, because we deal with more of able population compared to the rehab department, where they more deal with not able population. So we are more into MSK, musculoskeletal injuries, as well as even, like I mentioned earlier, the general population, okay, because everybody is known as an athlete, but maybe the general, we would maybe call them more of a weekend warrior. But everybody, if you see, everybody wants to get healthy, everybody wants to, get into sports, look good and everything. So it all comes down towards your health, towards your sports, towards your fitness. So everything is related. Even the private industry as well, even from the gym goers towards the fitness industry, wellness, even private hospitals. You know, so it's going towards that now. That is the future at the moment.
Okay, that's good to know. That's good to know. Now, I want to get into a little bit more details in terms of your work. You did mention you were involved in football games, you were involved in hockey games, badminton games as well as. Now, paint us a scenario. As a big football fan, I watch football matches, and then, every time a player lies injured on the field, you see the team doctor running with the bag and running into the field where the player is lying down. Can you describe to us that whole feeling of having to do all that, in front of, I suppose before the lockdown and whatnot, it will be in a stadium that is really full and whatnot. Explain to us that experience.
Yes. Yeah, okay, Andrew. So as you know, in Malaysia, football is a culture. Okay, it's the one game that brings everyone together. So as you mentioned, before the pandemic, when we do have, especially the finals, so it's a full house, everybody's cheering, it's super noisy, it's super loud. And we as the doctors, me being a match doctor, a tournament doctor, with my fellow medical assistants and even the ambulances, even with the team doctor and their own physiotherapy. So as much as we know, it's a huge culture and everything, but obviously we still have anxiety knowing that what is going to happen, what if something happened, not just to the players, mind you, but also to the stadium, because even the spectators that come there, if anything were to happen to them, we have to even look into them. So there's one final match before the pandemic started, where it was Indonesia versus Malaysia, and they had a few spectators who came in with firecrackers without not knowing by the security. And then they sort of had that blown up and everything. So one or two was a bit, thank God no one was severely injured, but they had abrasion or they had some kind of burn marks and everything, so we had to attend to them. And so it can get a bit sometimes a bit how would I say it, more very intense, because like you said, football is a culture, everybody is there cheering for their team, and so it gets very intense at the moment. So as much as we're also looking out for the players, and we also have to bear in mind that we also have spectators, we also have VVIPs then. So every point, you have to be alert, because you will get called to attend to any one of them in that particular stadium. So
it's interesting you describe it that way, because in my mind, when you were explaining it, I was thinking of a badminton match, and more often than not, you don't see a on-court doctor appearing in a badminton match, because the likelihood of a badminton player getting injured during a match is very little as compared to football, where the tough-looking guys fall down every 5 minutes, and then they start rolling on the grass, and then they require attention in that sense. But now that you have brought up the point about obviously spectators, the VVIPs and whatnot, I guess you got to be really on alert all the time, even when nothing happens. Correct?
Yeah, definitely. Like you're mentioning about badminton, I had the opportunity to go and cover for the Macau Badminton World Championship, or Badminton World Federation. And so we had a few cases where the players, the international players, had to call us in. So we have to go in there, and we're only given a few seconds, because the moment they have an abrasion or kind of wound over their fingers especially, because they're going to go back in and continue the matches. So you have to go in super fast, get it done, and get out of the court. So it can be intense from a few seconds all the way to 1-2 minutes, because that is their career, and that is their, so a lot of things is for the players itself, because whether it's sponsorship, whether it's teams, you're carrying your nation's flag. So there's a lot of stress as well for the players as well. So we have to make sure their well-being is taken care of, So that is why you have to be not just physically, I would say, but also emotionally. You have to be, as much as a very stressful environment, you have to be very calm, because in order for things to be smooth.
I just had a new level of appreciation for the work, people like you, Dr. Malini, do on court and on the field, because the way you just explained that just opened up a whole different perspective for me. As a person who just sits at home and watch, a match and whatnot, it's easy to criticize. It's easy to say things you don't want to. You hope that you didn't say to the player and say, why you can't play better and stuff like that, right? But it's not just the players now. I notice now that it's also the medical team that is on court, and not just on court during that one particular match, but on court throughout the entire tournament, correct? And there's so much of pressure on you all as well, and that's something we don't see on the screen. So like I said, I have got a newfound appreciation for the kind of work you do, Dr. Malini. Thank you so much for sharing that perspective to me personally, and obviously to our audience on Rejuvenate as well. That's really fantastic. Now, I suppose I want to ask, number one, is there a personal preference in terms of what kind of sports you are involved in terms of being a team doctor? And perhaps also if there's at this point in time in your career, a favorite tournament, you know, one tournament where you felt like you really learned a lot, there was a lot of, incidents or a lot of things that happened that help you to grow as a person, where you are able to put a lot of the academic knowledge into actual practice. Is there anything of that sort you would like to share?
Okay, to bring down to just one particular thing, the fact that I've covered football and hockey and even badminton, I would say in the fact that just in the terms of not just the players, but also the spectators and everything, I would say football is sort of like more something, because I've involved in a lot more sports coverage. So that is something which I would say that it's more personal for me, because the fact that I think I've learned a lot. You're put there and you get a lot of injuries, okay? Doesn't just matter whether it's just an MSK injury, you might even get a concussion injury, okay? And it's your call whether, you know, the player can continue back the game. And mind you, like I said, you know, if the player continue or doesn't continue, it does affect the team. So there's a lot of things that you have to be responsible. How many ambulances should be at the exit point, at the entrance point, because not just, especially when you have matches like FAM or even AFC, the Asian Football Confederation. So you're dealing with even countries from overseas that came down to Malaysia. So you have to be able to call the shots. You have to be able to tell to your to the management, you know, how many ambulances you need, how many medical assistants you need. What about the stretcher bearers? So stretcher bearers are those who run into the field to get the player out. What about the weather? You know, if there is a storm, or if it's just lightning, you know, are they allowed to go and continue the matches and everything? So it's a lot of decision making as a sports physician, I would say. So I would say that came into a lot of practice. Andrew, yeah.
Great. Now, I suppose I want to move into a little bit more of a personal question here. Family and perhaps your husband, how supportive has he been in terms of the kind of work you do today?
Okay, so like I said, it takes a whole, I would say, a village or entourage, especially when you're a parent, regardless whether you're a mom or dad, you know, especially when you have two young kids and all that. So for me, because without the support of them, there is no way I'm able to do what I'm doing. There is no way I'm able to travel. There is no way I'm able to be so even the helper that I have, you know, which I call her as my sister, you know, Auntie Christina, we call her that, who helps out with my children as well. You know, all this come into a play. That's why I usually don't like to use the word, you know, some of them would like to say, oh, you're a super mom. No. I wouldn't want to use that word at all, because it's the super entourage. It's the super, people behind me that helps me out with everything. So it's not easy, you know, because sometimes you have as a mom guilt to go and, you know, to be away and to this one. But it comes down to your family. It comes down to the support. Because, you know, they always believe that a happy mom is a happy surrounding, and the fact that I get to do my passion, I get to go and do my job, which I call a passion. You don't feel like a job, and you coming that, and your kids are seeing that, now even my kids are like, you know, they are into sports now. They are into this one because they're seeing their mama into it. So I feel like, you know, kids are very transparent. What they see is what they learn. And how you are, the aura you are, you know, what you ooze out and everything, it has to be what is outside, it has to be inside. So whatever you take back home, it's going to be. And I feel that, you know, with just how my parents have taught me, my siblings, I would like to even instill in them that, you know, just follow your passion, follow what you like to do, and with the right people and with the right support, and you will get that this one. And my husband being also in the orthopedic department, a doctor, and he also a part-time as a personal trainer and strength and conditioning specialist as well. So all this, because all of us are passionate about sports and fitness, so it has really helped us to know that, you know, what we are. And you know, in terms of that, I think that's where I get a lot of support from the people around me. So I'm very, very fortunate and humble. And my success is not an individual success, but it's the whole family, in-laws, friends, bosses, you know, the right colleagues, you know, that's what I feel that has got me into this particular career of mine.
Wonderful, wonderful. So ladies and gentlemen, for those of you who want to follow Dr. Malini's work a little more closely, she's available on LinkedIn. You know, all her ways of getting in touch with Dr. Malini is available on the platform rejuvenatemy.com under the speaker profile. You will be able to connect with her, and I'm sure she'll be more than happy to connect with our viewers here today as well. So once again, Dr. Malini, I thank you for your time. Thank you for you know, really shedding some light onto sports medicine and into your role as a sports physician and a team doctor for Team Malaysia. And I also, you know, truly am honored that you know, I've got a frontliner here who has shared her work with us as well. So all the best to you, Dr. Malini. I know you've got countless of talks and engagements coming on as well. So all the best to you on all that. And thank you so much for being on Rejuvenate Edition 5 and to sharing your passion and, as of course, also sharing your knowledge to the younger generation. Thank you.
Okay, Andrew, thank you so much again for the opportunity and also to Rejuvenate. And thank you again. And hopefully our paths cross again in the future. And stay safe.
Definitely. Thank you. So ladies and gentlemen, we will be back again at 1 p.m. We'll be talking to Chandreshan on his work using cricket to bridge the gap with the marginalized communities and whatnot. We will get more into that detail as we hit 1 p.m. So for now, we'll say bye-bye to you, and you know, do stay tuned. We've got a full day of you know, things going on Rejuvenate Edition 5. Dr. Malini, see you. Take care. Bye-bye.
Okay, take care.